My name is Rachel Myers, and I'm checking off Emily on medication administration. Her scenario is Tammy Everett is a 38-year-old female with an admitting diagnosis of congestive heart failure secondary to postpartum cardiomyopathy, and she is not breastfeeding. Along with her cardiomyopathy, she has a past medical history of hypertension and asthma. Her most recent vital signs are a temperature of 98.5 degrees Fahrenheit, a heart rate of 72 beats per minute, respirations of 16 breaths per minute, a blood pressure of 152/87, and an oxygen saturation of 89%, and she is on 4 liters per minute of oxygen via an oximeter. Her current medication orders are for digoxin 0.25 milligrams PO, nitropaced 1 inch topical, and Arobide 1 milligram, which is 2 inhalations.
Hi, my name is Emily. I'm your nurse. I'm going to be administering medications to you. Can I see your bracelet? All right. Can you state your name? Good. And your date of birth? Perfect. All right. I'm going to go ahead and get those ready, okay? All right. Now I'm going to scan the patient and make sure it's the right patient, and then it will bring up her name and then her documentations and her chart. And her medications, and then I'm going to see what medications I'm going to be administering and make sure that I have the right time, the right medications, the right dose, and the right route, and I have the right patient. And so first I see that I'm going to be administering digoxin, and so her drawer will pop out, and I'm going to pull out the digoxin. I'm going to scan that, make sure that it's the right, that it matches, that it's the right dosage, and it's the right route. And so I have that ready. And then I'm going to be giving that. And then I see that we're going to be administering nitro paste. So I'm going to pull out the nitro paste and the patch, and I'm going to scan that and make sure that it's the right route, the right dosage, right medication. And I'll put that aside because I'm going to be administering that. And then lastly, I see that we're going to be administering the Arobide, and that I would take that out, scan it, make sure that it is the right medication, the right route, and the right dosage. And I'll put that aside too. And I'm going to check for allergies and make sure she's not allergic to any of the medications. And I've scanned all of them, so I know that I'm going to be administering them. And then once again, before I actually pop out the pills, I'm going to check and make sure. So I'm popping out the digoxin, and I know that I'm going to be administering that now. And then I would throw away the tab, the excess materials, trash, whatever. And then I have everything ready. All right, and then I would educate the patient on what I'm going to be giving her. And the first thing I'm going to be giving her is digoxin, and I'm going to tell her what it does, and it increases the force and contractions of the heart, it decreases the heart rate, and some contradictions are that if the patient has hypersensitivity to digoxin, of course we would withhold it, and if she's pregnant or breastfeeding, and she just recently had a baby but she's not breastfeeding, so we can't give it. And then some side effects are headache, dysrhythmias, blurred vision, nausea, and vomiting. And then I would assess, before administering the medication, I would assess her pulse for at least, her apical pulse for at least 1 minute to make sure that it's above 60, because if it's below 60, we would withhold the medication. So that's digoxin. And then for nitroglycerin, again, we would tell her what it does, and it decreases preload and afterload of the heart, and it improves blood flow through the heart. And some contraindications are hypersensitivity to the product, and of course, again, pregnancy and breastfeeding, and again, we said that she is not breastfeeding. Some side effects are headache, tachycardia, nausea, and vomiting. And before I administer the medication, I would assess her pain level to see where she's at, so that after I administer the medication, I can come back 30 minutes and an hour after to assess her pain level at that time. All right, and then the last medication I'm going to be administering is the inhaler, the Arobide, and it's going to be 2 inhalations. and it's a bronchodilator, and if it was a corticosteroid, I would assist the patient after administering it with oral hygiene so she does not develop thrush. Okay, now that I've educated the patient and I know that I have the right patient, the right dose, the right route, the right time of administration, and of course the right drugs, I would assist the patient in taking the digoxin. It's a tablet, so I'm going to give her water to take it with, or whatever drink she would like to take it with, and have her swallow it, and then I would check to make sure she did in fact swallow it. And once we're done with that, I'm going to go ahead and of course I would have completed hand hygiene and I would have gloves on for this. But I'm gonna go ahead and do the inhaler first so that I can do the nitro last. And I can either help her with this if she's not able to help me, but it would be good if she can do it because of course when she goes home she's gonna have to do it herself. So once, if I'm helping her, she's helping me do it, I'm going to have her hold her thumb on the bottom and a finger on top, and she can either place it inside of her mouth or just outside of her mouth, and she's going to inhale for 2 to 3 seconds, and then while she's dispersing the medication, administering the medication into her mouth, and then she's going to hold that for 10 seconds, and then she'll remove it from her mouth after holding it, and then breathe out through her nose or through her pursed lips. Then we're going to wait 30 seconds to a minute between administration of the second inhalation, and then we'll do the same process for that. And again, we're going to assist her with oral hygiene afterwards, if it's a corticosteroid, to decrease chances of her developing thrush. I would have assessed during this if she were doing it herself to see how well she did it, because we want her to be administering the medication correctly, and I would assist her in correcting any techniques that she did wrong. And now I would go ahead and do the nitro paste, and I would, it says to do what the orders say to do 1 inch, so I'm going to squeeze out 1 inch onto the patch, and I'm going to see if she has a patch on her first of all, and I'm going to remove the patch and assess that area to make sure that area is good to go, and then I'm going to go to the completely other side of the body to put on this new patch. After I've squeezed out the 1 inch onto there, I'm going to first assess the skin on where I'm going to be putting the patch, make sure there's no excess hair, that it's dry and it is intact, and I'm going to go ahead and put the patch on there. I'm going to tape all 4 corners, make sure it's secure, and then I'm going to put my initials and time and date it, and then I'm going to go ahead and get rid of all my trash and all that kind of stuff, and I would make sure that she's comfortable, and I would take off my gloves and wash my hands once again, so that I don't have any effects of the nitro towards me or towards any other patients. And I would again make sure she's comfortable, make sure her call light is in place, and then I would again wash my hands and put on gloves, and I would document the procedure and the medications that I gave to her, and then again of course I would come back and assess her pain later, and I would document that as well.